Hello everyone, we are here on day 2 of the CGA-IGC annual meeting in Philadelphia. My name is Megha Ranganathan. I'm a genetic counselor at Memorial Sloan Kettering Cancer Center and the chair of the CGA-IGC Communications Committee. I'm thrilled to be joined here today by Dr. Randall E, who is a gastroenterologist at the University of Pittsburgh Medical Center and an expert in the field of hereditary GI cancers. Many of you may know that November is Pancreatic Cancer Awareness Month, and to commemorate it, Dr. Rand has kindly agreed to talk to us about pancreatic cancer screening and the recently published paper in JAMA Oncology by Blackford et al. Titled Pancreatic Cancer Surveillance and Survival of High-Risk Individuals. Thank you for joining us, Dr. Rand.
Thank you.
So, Dr. Rand, my first question for you is, what is the main takeaway from the Blackford et al. paper?
Well, the first thing I want to say is, as a point of disclosure, I am a co-author on this paper. So I think for full disclosure that needs to be stated. This is a study from the CAPS-5. We reported on outcomes of surveillance and compared it to patients who presented as we normally would, and so they got data from the SEER database and compared it to our registry. Our take-home message was that when you had patients who were undergoing surveillance, you were able to find the tumor at an earlier stage, and that this led to better long-term survival. We don't have enough patients yet to say whether it leads to more cures, but many patients are tending that way, which is quite remarkable.
Thank you, Dr. Brand. And what do you think are the main limitations of this paper?
The main limitation, which is good for our high-risk patients, but makes it difficult for us to make firm comments about the benefits of surveillance, is actually there was only 26 high-risk individuals who we had a screen detected pancreatic cancer. And so those are very small numbers to make comments with. It should be noted that 6 of those patients were what we call prevalent cancers. So those are cancers that were found at the time of their first screening test, even though they were asymptomatic. But that our results are even better on incident cancers, which are patients who don't have a finding on their first exam, and then you go and subsequently follow them, that the outcomes were even better. So I think it does really push for annual surveillance with endoscopic ultrasound or MRI.
Thank you. And Dr. Brand, as you know, the NCCN recently updated guidelines recommending pancreatic cancer surveillance to all individuals with a germline ATM or BRCA2 mutation. So I'm curious, what is your approach to screening these individuals?
Well, thank you for that question. We have definitely noticed an increased number of referrals to our high-risk screening program. I have to tell you that now that the recommendation is there, I think it's even more important to meet with each individual that you're recommending surveillance. Unlike a colonoscopy, where I'll meet these individuals in the GI lab with the procedure on demand, I never initiate pancreatic cancer surveillance on any patient without sitting down and having a discussion of the risk, benefits, and limitations of surveillance. And I think this is particularly critical in patients that are at less risk, like these ATM and BRCA2 carriers. And so I think it's going to be tough. And I think a lot of centers who are doing it high risk are going to be getting a lot of additional referrals. And time will tell whether or not that actually will need to be rethought about in the future. And maybe at the end of the day, what we really will need is to figure out who's at high risk in these high risk individuals and who's at low risk in these low risk individuals. So take home point, if you're going to care for these patients with ATM and BRCA2, please try to send them to centers that are at least enrolling them in registries and trying to learn and get and follow long-term follow-ups so that we can at least try to see whether we can improve on determining who actually deserves to be screened.
Absolutely. Thank you so much, Dr. Rand. We really appreciate your time. and happy Pancreatic Cancer Awareness Month to everyone.